It's a health practice many Canadians are struggling to keep up with. And now, a new study in the British Medical Journal has found younger people aren't doing enough to prevent harms from too much sun.
Unfortunately, Canadians and people around the world still think of a tan as sexy and not deadly.
Canadian cancer statistics shows more than 11,000 people were expected to be diagnosed with melanoma in 2024, a 17% increase compared to 2023, according to Melanoma Canada. The study found 90% of melanoma cases come from excessive UV exposure. Using data from the Canadian Community Health Survey, the report determined 3/4 of Canadian adults spent at least half an hour in the sun between 10 a.m. and 4 p.m. on days off over the summer. 2/3 reported using sunscreen on their body irregularly or not at all, while 58% said they use sunscreen on their face irregularly or not at all.
The best way to get melanoma is to get a couple of sunburns through the year.
Dr. Ivan Litvinov was the senior author of the paper that determined the country has to urgently respond to increased sun exposure with a comprehensive plan from public health agencies and government legislation.
So we need to take a hard look at the cost of melanoma, which is substantial, and the cost of the prevention efforts for melanoma, and make a decision.
The study determined the cost of all skin cancers in Canada is projected to reach close to $1.4 billion. Dermatologists say there are a handful of practices that people can adopt, including reapplying sunscreen when outdoors, wearing protective clothing, and staying in the shade during the warmest hours of the day. And they say even Canada's frigid winters are no escape from sun damage.
It gives people a false sense of security that because it's colder here, and a lot of the months sometimes are gray and a bit more gloomy, at least sometimes in Toronto, that you don't need sunscreen.
The research found that due to changing habits, 1 in 3 new cancer cases is a patient with skin cancer. Kyle Benning, Global News.